What to eat and drink when you have food poisoning. It's best to gradually hold off on solid foods until diarrhea and vomiting have passed. Instead, ease back into your regular diet by eating or drinking simple-to-digest items that are bland and low in fat, such as saltine crackers, toast, gelatin, bananas, rice, oatmeal, bland potatoes, boiled vegetables, chicken broth, soda without caffeine, such as ginger ale or root beer, diluted fruit juices, sports drinks. What to avoid? To prevent your stomach from getting more upset, try to avoid the following harder to digest foods, even if you think you feel better. Dairy products, especially milk and cheeses. Fatty foods. Fried foods. Highly seasoned foods. Foods that are high in sugar. Spicy foods. How food poisoning is diagnosed. A doctor may be able to diagnose the type of food poisoning based on your symptoms. In severe cases, blood tests, stool tests, and tests on food that you've eaten may be conducted to determine what's responsible for the food poisoning. A doctor may also use a urine test to evaluate whether you are dehydrated as a result of food poisoning. Risk factors for food poisoning. Anyone can come down with food poisoning. Statistically speaking, nearly everyone will come down with food poisoning at least once in their lives. There are some populations that are more at risk than others. These include immunocompromised people. Anyone with a suppressed immune system or an autoimmune disease may have a greater risk of infection and complications resulting from food poisoning. Pregnant people. Pregnant people are more at risk because their bodies are coping with changes to their metabolism and circulatory system during pregnancy. Older adults. Adults who are 65 years or older also face a greater risk of contracting food poisoning. This is because their immune systems may not respond quickly to infectious organisms. Young children. Children under 5 years old are also considered an at-risk population because their immune systems aren't as developed as those of adults. Young children are more easily affected by dehydration from vomiting and diarrhea. How to prevent food poisoning? The best way to prevent food poisoning is to handle your food safely and avoid any food that may be unsafe. Some foods are more likely to cause food poisoning because of the way they're produced and prepared. Infectious agents that are killed during cooking may be present in certain foods, such as meat, poultry, eggs, shellfish. Food poisoning can occur if these foods are eaten in their raw form, not cooked properly, or if hands and surfaces aren't cleaned after contact. Other foods that are likely to cause food poisoning include sushi and other fish products that are served raw or undercooked, deli meats and hot dogs that aren't heated or cooked, ground beef, which may contain meat from several animals, unpasteurized milk, cheese, and juice, raw, unwashed fruits and vegetables.